Okay, let's dive in. How do you even begin to get a handle on a field as huge, as complex as something like gastrointestinal surgery? I mean, where do you start?
It's a massive challenge, isn't it? Information overload is real, especially in these super specialized areas. It can feel, well, pretty overwhelming.
Absolutely. So today, we're doing a deep dive, but maybe not in the way you'd expect. We're not looking at surgery itself.
Right. Thankfully for us, we're looking at how people master fields like this.
Exactly. We're using a specific resource as our guide.
Our source material gives us a look at this book, 100 Questions and Answers in Gastrointestinal Surgery by Dr. Atef Ahmed.
Right. So our mission here isn't to teach surgical techniques, obviously.
Yeah, definitely not.
It's more about unpacking this resource to see how essential knowledge gets organized, how it's accessed, and, importantly, how it's kept up to date in such a demanding field.
Kind of like finding out the strategies experts use to, cut through the noise and stay current.
So what jumps out right away from the source material about this book?
Well, the first thing is its structure. It's entirely built around a question and answer format.
And that's not just random, is it?
Yeah.
The source really highlights that format.
No, it seems very intentional. It's designed, apparently, to really boost understanding and make learning easier.
And also helps with just finding things quickly, right? Like for quick reviews.
Exactly. It almost simulates that clinical environment, where you're constantly being asked questions or needing answers fast.
That makes a lot of sense. It gets straight to the point.
Precisely. It tackles those common questions, those critical points of knowledge. Think about someone training in surgery, a resident maybe, or a fellow doing advanced training.
Yeah.
They're always facing questions, right? On rounds, in the OR, definitely when prepping for board exams. So a Q&A format kind of mirrors that whole experience.
Okay, I see. It directly addresses that need.
Yeah.
And the source mentions the sheer breadth of topics covered using this format.
Oh, yeah. They emphasize a wide range, and looking at the details they provide, it really seems comprehensive.
It says, from basic principles to intricate surgical techniques.
And postoperative care. So it's the whole spectrum, not just the how-to in the operating room, but the why behind it and the what happens next.
And the source gives examples, like stomach, intestinal, colon surgery.
Uh-huh.
Oh.
Liver surgery, too.
Yeah.
But also things like diagnostics, figuring out the problem in the first place,
Right.
and managing complications if things don't go perfectly, plus navigating the whole recovery phase. It seems to cover the patient's entire journey within GI surgery.
All broken down into these questions and answers.
Exactly. Discrete, manageable chunks.
Okay, covering a lot is great, but medicine moves so fast, especially surgery. How current is this information?
That's a critical point, and the source addresses it. It says the answers are supported by the latest research and guidelines.
So it's kept up to date.
Seems so. And it mentions this blend of evidence-based practices, so what the actual studies show works,
Yeah.
and clinical wisdom, that practical knowledge you only get from experience from actually doing the procedures for years.
Ah, that blend sounds really valuable. It's the science meeting the sort of art of it all.
Absolutely. And that combination, plus the Q&A structure, points to how practical the book is meant to be,
The source calls it a practical approach, says it's easy to navigate.
making it an ideal reference for busy professionals. You can picture it, right?
Yeah.
A resident needing a quick fact check before a case, someone cramming for boards, or even an experienced surgeon just wanting a refresher on something specific.
So it's designed for that rapid access to reliable info. You're not wading through chapters.
You're getting the answer you need, like right now. That seems to be the idea.
And the reliability, the credibility, that comes down to the author, Dr. Atef Ahmed. What does the source say about him?
He's described as a respected figure, a renowned expert.
Okay.
And crucially, the source highlights that he combines scholarly expertise with practical experience.
So he knows the research and he's actually done the surgeries.
Exactly. The best of both worlds for a resource like this. The source even says his insights are both deep and accessible.
Meaning he can explain complex stuff clearly.
Right, making even the most complex of concepts easy to grasp. That's the sign of a great teacher, isn't it? Translating complexity.
Definitely. Okay, so we have a clear picture of the book. Q&A format covers a huge range of GI surgery topics, up to date, blends evidence and experience, written by a top expert, and designed for practical use by medical pros.
Surgeons, residents, fellows, other healthcare professionals involved in GI care, yeah.
But let's zoom out a bit. Why is understanding a resource like this useful for you listening now? You might not be in medicine at all.
That's a great question, and I think this is where the deep dive gets interesting beyond just surgery.
How so?
Well, by looking at how experts in a really high-stakes field organize and access knowledge, we can learn a lot about managing complexity in our own lives, our own fields.
Okay, I see. So the principles are transferable, like
Right.
that Q&A format.
Exactly. It's not just for doctors. It taps into a powerful learning technique called active recall,
Right. Instead of just reading passively, you have to actively pull the information out of your brain.
which makes it stick much better. It strengthens memory and understanding way more than just, highlighting a textbook.
So this book's structure is basically a masterclass in efficient active learning.
Pretty much. And it teaches us the value of identifying the core questions in any subject. What's the really essential stuff? What are the frequent challenges?
Focusing your energy instead of getting lost in the weeds.
Right. A resource like this helps you find that critical path.
And what about the point about blending the latest research with clinical wisdom?
I think that tells us something important, too. In any field that changes, fast tech, business, science, whatever mastery, isn't static. It's not a final destination.
It's more of a continuous process.
Yeah, a process of constantly updating, integrating the new stuff, the research, with what you already know and what works in practice, the wisdom.
And a good resource helps you do that bridging constantly.
It really shows the power of good curation, doesn't it? In this age of endless information, having an expert like Dr. Ahmed boil things down to 100 key questions and evidence-backed answers.
It's like having a trusted guide.
Exactly. A guide with a spotlight in a huge, dark library, showing you what's important.
So the takeaways for everyone listening are pretty universal then. Find the core questions. Use active recall. Look for resources that are current and grounded in experience. Value expert curation.
Absolutely. This surgery book just happens to be a really clear example of those principles in action. It's a blueprint for efficient learning in a field where knowing your stuff is, well, critical.
Okay, so to wrap up our deep dive on the info around this book, we've seen its Q&A structure is a powerful learning and reference tool for a complex field like GI surgery.
Mm-hmm. Comprehensive, up-to-date, blending science and experience.
Right, with a credible expert author. And importantly, we've pulled out those lessons for managing complexity anywhere. Active learning, finding the core info, continuous updating, and good curation.
It's a specialized tool, but it demonstrates some really universal ideas about managing knowledge effectively.
So here's something to think about as we finish. The source material says the book is about mastering the art and science of gastrointestinal surgery, and it talks about advancements and latest research
Right.
in fields like surgery, or maybe even your own field, where things are always changing, where today's latest research is tomorrow's old news. What does it really mean to master something?
That's a deep question.
And how does a resource like this, designed for ongoing updates, quick reference, not just static knowledge, how does that reflect the idea that maybe mastery isn't about knowing everything now?
Perhaps it's more about being incredibly skilled at learning, adapting, and integrating what you need to know next.
Maybe mastery in these dynamic fields is less like climbing a mountain and planting a flag.
And more like learning to navigate a constantly shifting landscape, having the right tools and skills to keep moving forward effectively.